Hello, Baltimore. It's Dr. Jeff Kalkstein with Kalkstein Chiropractic, your Baltimore area chiropractor. And I'm with Susan today. And Susan, you've been having some difficulty with your back for how long?
10 years or more.
10 years or
and
more.
Before that, I had difficulty because I would have severe muscle spasms. But I don't have those anymore.
But so you had low back pain and you had leg pain, right?
Yes, since I've been about 40.
40.
But now I've developed the leg pain.
Okay. And how long have you had that for?
That's been about 10 years.
Yeah. And so what motivated you to come back and see us in February?
Well, I was thinking that I had seen something online about the traction.
Yes.
And something told me maybe that would help me.
Okay.
And so I thought, I had had good results with you before when I was coming to you for the muscle spasms.
And that was a while ago, right?
Well, that was
more than 10 years ago, wasn't it?
Much longer.
Yes.
Yeah.
Because we were neighbors then.
Yeah, but I've had this professional relationship with you for much longer than that.
So she came back in February with low back pain and some things going down the legs. We updated our history. We did an exam where we checked your muscle strength, your range of motion, and those types of issues. And then what did we do then after that?
Well, you right away got me onto the traction, I think. Yeah, you adjusted me and
we did traction?
Yeah.
And did we show you some exercises to do?
And I did exercises. I did the knee, they're flexion exercises, right?
Yes, they're flexion, yes.
Okay.
Very good.
With the deep breathing and letting the breath out and then pulling the knees in a little bit further. And also, I did a little bit of back bending, but you decided that
we didn't like that direction, did we?
That wasn't as good as the other.
We didn't. It wasn't us that didn't like it. It was her body didn't like it. So what? And what Susan is saying, we have a traction table that has decompression capability. We use that, and then we're a chiropractic office, but there was a physical therapist by the name of Mackenzie who developed a movement preference pattern. And the movement is either forward bending or backward bending, and you can build in each direction. And we realized that probably 70% of the people are more back extension driven, right? They get relief with extension. And we tried that with you. It wasn't improving your condition. It probably actually made it a little bit sore. So we switched and we went to the flexion, and that was the sweet spot, right? Yeah. And then we adjusted you. So it's been probably now 2 weeks, right? Yes,
exactly.
And maybe what, 6 treatments or so?
Yeah.
There's 3 there, and
or maybe
7 treatments.
7
treatments. From the time you first came back in February to now, what percentage do you think your pain symptoms have decreased? By what percentage? 50, 60, 75?
I would say at least 50 to 60.
50 to 60?
Yeah.
And that's pretty dramatic for you, right?
It is.
What has it allowed you to do that you couldn't do before you started seeing us? What did you stop doing, or what were you doing that you paid a price for?
Well, just about everything.
Yeah.
A lot of bending with housework and stuff, and standing on my feet in one position to cook, or just moving around slowly. And just doing the basics. Has taken a lot of grit, because the medicine that I'm taking for the nerve issues doesn't work as well.
Wasn't touching it.
And grocery shopping became an ordeal if I didn't do just a small trip.
Had you continued your workouts? I know you work out with someone, right? Were you working out?
All throughout the treatments.
Have the workouts become more tolerable since you've been getting treatment?
Well, I would say yesterday I had a good day. I'm much more tolerable.
Yeah, awesome,
I did 40 pounds on the row machine.
And you go to Greta?
Twice a week.
Twice a week, okay.
It's only a half an hour.
Yeah, awesome. Let me put this chart down for 1 second.
Okay.
I just want to see how you move before we continue.
All right.
So I think you probably have seen people on traction. We can show that to you maybe the next time you come in. And we can also show you the Mackenzie protocol that we're using. But right now, if you'll just stand up here, let me see you lean to this direction. Lean to your left for me. Any discomfort there?
No.
No, good. Now go back the other way for me. Any discomfort there?
Just a little pulling.
And where do you, what side do you feel it on? More on that side?
Yeah.
So go back this way one more time. Yeah. Any discomfort there at all? Now go back this way for me. Any discomfort there?
Just the,
So it's still there.
the
Yep.
pulling, but
Yep.
it doesn't hurt. Let's say
Perfect. Now I'm going to put my hand on the small of your back and I'm going to put my hand on your sternum. I want you to go back in extension. Try not to bend your knees so much.
Don't.
There you go.
Okay.
Now does that bother you at all?
It's not.
And if I bring you over in this direction, I put a little pressure. Does that bother you a little bit? Beautiful. And come back this way for me. Does that bother you at all?
That bothers me more.
Which side?
interestingly
Which
enough.
side?
When you bend me that way.
On what side did it bother you on? Right in there. Let's see you touch your toes for us, okay? Just go ahead,
Okay.
bend down and touch your toes. And try not to bend your legs. Good. Come on up for me now. Very nice. Okay. All right. Let's have you stand up here on your left side down and face that way.
Left side.
Yep, so there's some limitation of motion at the very end on both right and lateral bending. There's a little bit of limitation on when she bends backwards. And when she, here, Susan, if you have one hand on the pillow or anything, put your up on the table.
Oh, sorry.
There you go. When she bends forward, you can really feel where you can really see where her right sacroiliac joint is really locked up and fixated, okay? So let me have this arm out like this. Bring this in. Bring your leg up like this for me. So again, the purpose of the adjustments are to restore normal motion to the spinal segments. And when you do that, it sends signals to the muscles and they relax, and the pain fibers calm down, the muscle tension reduces, right? So I'm going to tap Susan on her hip a couple times. Beautiful. Did that hurt at all?
No.
No, good. On your back for me. And let's have you turn all the way over this way. See, I think when you first came in, you couldn't even turn over on the table that freely, could you?
No.
Now straighten this leg out for me. Bring this up and right here. And bring this around this way.
Okay.
Beautiful. And I want you to relax. I'm just going to take a little tension back into this
Okay.
hip. And if you can let that loose for me. Take a breath in. Let it out. Beautiful. On your back for me. The next thing I'm going to do is I'm going to give both legs a pull to adjust her hips because I want her hips to move as well as her back, all right? So relax for me. Beautiful. Slide up, Susan. Use your legs. Push yourself to the top. There you go. Beautiful. Relax, relax. That away. So hands over your head. And bring it back up. That away. Beautiful job. So what I really like is I think it's getting you back to doing your normal daily activities and not paying so much of consequence anymore. What I'm really excited about is the fact that you're able to now go and resume some of your exercises for strengthening. Because and I know the trainer, she's outstanding. Because what we would do next here in the office, we'll probably show you some stabilization, some low back stabilization. So we're going to go from we're still going to do the traction. The Mackenzie, I think you have that down pretty good, and you'll do that at home.
I do.
How often did you do it in the beginning when you first started with us? How many times a day were you doing it?
I guess once a day, twice a day.
Okay?
Yeah.
So we're going to go from doing those activities to strengthening this, to make sure we're just waking those muscles up, okay? So if you can step off. Anything else you want to share with Baltimore out there?
Well, happy spring. I'm going for a walk.
There you go. That's beautiful. Thank you, and I'm glad you're feeling so much better.
Thank you.
Thank you. Thank you, Baltimore.